The night shift at Metropolitan General Hospital was usually quiet, which suited me perfectly. Between caring for patients, I could study surgical journals and review case files without interruption. Most of the doctors never noticed. They were too busy looking down their noses at the night nurse. My name is Dr. Linda Chen, though at Metro General, I was just Nurse Chen. They didn't know about my surgical license, my years of practice abroad, or the fact that I'd chosen to work as a nurse while waiting for my U.S. credentials to be processed. Sometimes the best way to learn a hospital's true culture is from the bottom up. Room 412 needs fresh linens. Dr. James Morrison, the chief of surgery, called out as he passed the nurse's station. "That's more your speed than reading medical journals, isn't it, Chen?" I carefully marked my place in the latest neurosurgical review. "Right away, Dr. Morrison." He paused, noticing the journal. "Don't waste your time with that. Focus on your actual duties." What Dr. Morrison didn't know was that I'd written 3 of the articles in that journal under a different name. Or that while he was busy belittling nurses, I was consulting on complex cases with surgeons across Asia and Europe via secure video calls during my breaks. "Linda, got a moment?" Sarah, the head nurse, approached after Morrison left. She was one of the few who knew my full background. "Dr. Morrison's scheduled for a complex spinal surgery tomorrow. Patient's films just came in." I followed her to the private consultation room where we could review the scans. "This approach he's planning," I murmured, studying the images. "It's extremely risky." "That's what I thought," Sarah nodded. "But he won't listen to nursing staff about surgical matters." I made detailed notes about the potential complications, knowing I couldn't say anything directly. Morrison would never accept surgical advice from a nurse, even if that nurse had performed this exact procedure successfully dozens of times. My phone buzzed. A message from Dr. Wong at Singapore General Hospital. "Your assessment of the temporal lobe case was spot on. Patient recovering perfectly. When are you returning to surgery?" "Soon," I typed back. "Use credentials nearly processed. Just need to finish my observational period." What I didn't mention was that my observational period was self-imposed. I could have started the formal credential transfer process months ago. But I'd wanted to understand Metro General from the inside first. What I'd seen wasn't encouraging. Morrison's dismissive attitude toward nurses wasn't unique. The hospital had developed a rigid hierarchy where nurses' observations were routinely ignored, even when they had crucial insights about patients. It was dangerous and outdated. "BP's dropping in 205, called another nurse. "Dr. Harrison says not to bother him unless it's an emergency." I checked the patient's chart. "Get him now." These readings combined with her history, I stopped, reminding myself I couldn't give medical orders. "Maybe mention the Davidson case from last month. Similar symptoms." The nurse nodded, understanding my subtle hint. Sometimes we had to play these games to get doctors to pay attention. Later that night, reviewing Morrison's surgical schedules, I noticed a pattern. He was taking on increasingly complex cases, often using outdated techniques. His complication rate was rising, but his position as chief of surgery made him practically untouchable. "You should see his handling of basic procedures," whispered Dr. Peters, a junior surgeon who sometimes spoke to me during quiet night shifts. "It's like he stopped learning new techniques 15 years ago." I nodded, thinking of the spinal surgery scheduled for tomorrow. Morrison planned to use an approach that had been largely abandoned due to risk factors, the same approach that had cost me a patient in my early days, pushing me to develop a safer alternative that was now standard practice in many countries. My phone buzzed again, the medical board this time. My U.S. credentials were finally approved. I could officially practice surgery again. "Perfect timing," Sarah said when I showed her the email. "Morrison's been refusing to update his certifications. The board's getting concerned." I tucked my phone away, continuing my rounds. In my bag was a copy of my full credentials, including documentation of every surgery I performed, every paper I'd published, every technique I'd developed. Tomorrow, Morrison would attempt a dangerous surgery that I'd specifically written papers about improving. "Night shift treating you well, Chen?" Morrison asked mockingly as he prepared to leave. "Must be inspiring, watching real doctors work." "Very educational," I replied quietly. He had no idea just how educational these nights had been. While he'd been busy looking down on nurses, I learned everything about how his department operated. Every outdated procedure, every ignored safety protocol, every dismissed nurse's observation, all carefully documented. Big surgery tomorrow, he boasted. Though I suppose spinal reconstructions are a bit beyond your comprehension. If only he knew that surgeons across Asia studied my papers on that exact procedure. That I developed a safer technique after learning the hard way what could go wrong with his outdated approach. But he'd learned soon enough. Opening my locker, I touched the folded surgical cap I carried every day. The one I'd worn during hundreds of successful operations. Tomorrow it would come out of hiding along with everything else. Dr. Linda Chen, attending surgeon, I practiced quietly, remembering how it felt to command an operating room. After months of being underestimated and dismissed, it was time to step back into my true role. Sarah appeared in the doorway. Morrison's insisting on doing the surgery his way. No pre-operative consultation with other departments. I smiled grimly. Don't worry, tomorrow will change everything. And it would, just not in a way Morrison expected. Sometimes the best way to fix a broken system is to understand it from the ground up. To watch, learn, and document until the perfect moment arrives to implement real change. I had one more set of rounds to complete before my shift ended. One more night of being just a nurse before tomorrow's surgery would reveal exactly who I really was. The hospital corridors were quiet as I made my final checks. In a few hours, these same halls would witness something unprecedented. But for now, I simply changed linens, checked vital signs, and listened to patients, all while carrying the knowledge that could save not just tomorrow's surgical patient, but the entire department's future. Sometimes the best expertise hides in plain sight, wearing nurses' scrubs and waiting for the right moment to emerge. The operating room buzzed with tense energy as Dr. Morrison prepared for the spinal reconstruction. I stood in my usual corner, officially present as the surgical nurse but watching with a surgeon's eye as he made his first incision. Blood pressure's a bit high, I noted quietly. Focus on your job, Chen, Morrison snapped. I don't need nursing observations during delicate procedures. The procedure was anything but delicate. His technique was exactly what I'd warned about in my papers. Too aggressive, too risky, ignoring the advances of the past decade. BP continuing to rise, the anesthesiologist reported. Doctor, perhaps we should. I know what I'm doing, Morrison cut him off, pressing forward with his outdated approach. I watched the monitors carefully, recognizing the warning signs. This was exactly how my case had gone wrong years ago, pushing me to develop a better technique. Doctor, Sarah called from her position. The patient's readings. Enough. Morrison's hand trembled slightly. I don't need nurses telling me how to. He never finished the sentence. His eyes rolled back and he collapsed, his scalpel clattering to the floor. Code blue, someone shouted. Doctor down. But there was still an open patient on the table, their spine exposed, the procedure at a critical point. Get another surgeon, the anesthesiologist yelled as staff attended to Morrison. There's no time, I said calmly, stepping forward and removing my nursing cap. From my pocket, I pulled my surgical cap and credentials. I'm taking over. You're what? Dr. Peters stared as I quickly scrubbed in. Dr. Linda Chen, board-certified neurosurgeon, licensed in 12 countries. I moved to the table, assessing Morrison's work. I've performed this exact procedure over 100 times. In fact, I developed a safer technique for it. The room froze for a moment, then training kicked in. Questions could wait. The patient came first. Nurse Williams, please handle Dr. Morrison. Everyone else, refocus. We have a patient to save. For the next 4 hours, I demonstrated exactly why my technique had become standard practice across Asia and Europe. Every movement was precise, incorporating the latest advances in spinal surgery. Incredible, Dr. Peters whispered as I navigated a particularly delicate section. I've never seen this approach before. That's because it's my approach, I replied, carefully completing the reconstruction. Published in the Journal of Neurosurgery last year under my research name. There's a reason I've been reading those journals during night shifts. As I finished the final sutures, the operating room door opened. The hospital administrator and several board members entered, summoned by the emergency. What's going on here? The administrator demanded. Who authorized? Dr. Linda Chen. Sarah handed them my credentials. Her U.S. license was approved yesterday. She's been consulting internationally while working here as a nurse. The administrator scanned my documentation, eyes widening at my publication record and case history. You've been working as a nurse? Why? Because sometimes you need to understand a system from the ground up to fix it properly. I stepped back from the perfectly completed surgery. Just like you need to understand basic anatomy before attempting complex procedures. Morrison had recovered consciousness and was watching from a chair, his face ashen. You're a surgeon. One who's published extensively on the dangers of the exact approach you were attempting. I turned to the board members. While working night shifts, I've documented numerous instances of outdated procedures, dismissed nursing observations, and compromised patient safety. I believe it's time for some changes at Metro General. The next few hours were a blur of explanations, demonstrations, and revelations. My international colleagues joined video calls to confirm my expertise. My published papers were reviewed. My documented cases were examined. 1 week later, I sat in my new office, Chief of Neurosurgery, a position created specifically to implement the changes Metro General desperately needed. First order of business, I addressed the assembled surgical staff. We're implementing a collaborative care model. Nurses' observations will be given proper weight. All surgeons will maintain current certifications and knowledge of modern techniques. Morrison, demoted but retained under supervision, sat quietly in the back. His outdated approaches had finally caught up with him, though not in the way he'd expected. Dr. Chen, a young nurse, raised her hand. I've actually been studying surgical techniques in my spare time. Let's discuss your career path after the meeting, I smiled. Expertise can come from unexpected places after all. Over the next year, Metro General underwent a transformation. We established new training programs encouraging nurses to develop advanced skills. Surgical outcomes improved dramatically as modern techniques replaced outdated procedures. The story of the night shift surgeon spread through medical circles, encouraging other hospitals to examine their own hierarchies and assumptions. Articles were written about the importance of collaborative medical care and the danger of dismissing expertise based on current roles. Morrison eventually retired, but not before witnessing the revolution he inadvertently sparked. The last time I saw him, he was actually listening to a nurse's observations about a patient. 2 years after my revelation, I stood in the same operating room where everything had changed, now teaching a new generation of surgeons. Some of whom had started as nurses. The most important lesson, I told them, isn't just about surgical technique. It's about recognizing that expertise can hide in unexpected places. Sometimes the person changing bedpans today could be teaching advanced procedures tomorrow. Sarah, now the director of nursing, joined me for coffee in my office. Remember when Morrison told you to stick to changing bedpans? I think about it every time I approve another nurse for surgical training, I replied. His biggest mistake wasn't his outdated techniques. It was assuming that titles define capability. My phone buzzed with a message from Singapore. Another hospital interested in implementing our collaborative care model. On my desk sat applications from nurses seeking advanced training, alongside papers published by former night shift staff who'd revealed their own hidden expertise. You could have exposed Morrison sooner, Sarah noted. Why wait? Because real change isn't just about replacing one person, I explained. It's about understanding and transforming an entire system. Sometimes you have to start from the bottom to fix things properly. Opening my laptop, I reviewed the latest hospital statistics. Surgical success rates up 40%, complications down 60%, nurse retention improved by 80%. But the most significant change wasn't in the numbers, it was in the culture. Now when someone says just a nurse at Metro General, they're quickly reminded of the night shift surgeon who transformed their hospital. Of how expertise can hide behind any title, waiting for the right moment to emerge. In the end, Morrison had taught me something valuable, though not what he intended. He'd shown me that sometimes the best way to fix a broken system is to experience it from every level, to understand not just the procedures, but the people. And sometimes the most powerful expertise is paired with the patience to wait for exactly the right moment to reveal it. Every morning as I walk through the hospital corridors, I pass the nurses' station where I spent so many nights studying and observing. It's a reminder that titles don't define capability. Actions do. And sometimes the quietest person in scrubs might just be the one who changes everything.